Live from 6 News Studios with live, local breaking news where you live and your hour-by-hour forecast. This is 6 News, live at midday.
I'll give you a phone call.
Knee replacement is an unfortunate reality for a lot of people for a variety of different reasons. And we're going to talk to a surgeon about the procedure and what we can all do about arthritis coming up in just a minute.
But first, as we go...
There are a lot of different factors that can lead to severe joint pain and in severe cases, even joint replacement. Dr. Ajoy Jana is an expert in the field, an orthopedic surgeon from Methodist Physicians, and we're happy to have him back with us today. Thanks for stopping by.
Thanks so much, Jim, for having me.
Dr. Jana, when we talk about the leading causes of joint pain and then maybe even joint replacement surgery like a knee replacement, what are some of the things that you would say lead to the most severe cases?
Well, typically, there's a genetic component. A lot of people with arthritis, their mom or their dad have had it. It's not always the case, but it's commonly the case. Being overweight plays a role, and then prior injuries when you're younger, sports injuries, etc., car accidents, things like that.
Yeah, my brother played football throughout, and is pretty banged up right now, and he stopped after college. I can only imagine the wear and tear that contact sports and even a sport like basketball, which a lot of starting and stopping has as we advance into our 40s and 50s. Is it a lot of old jocks that end up in your office?
Oh, absolutely. I mean, even patients that have, let's say, torn their ACL and had it reconstructed, we used to advise them to have it fixed because we thought we would prevent arthritis from developing later.
Yeah.
But actually, studies are showing even if you have it fixed, and you still probably need to for stability, for day-to-day activities or to return to sports, in the end, though, 20 years later, you're just about as likely to get arthritis as if you didn't have it fixed.
Yeah, you hear about guys who can't even walk 18 holes when they're done with their NFL career because of the knees, and I guess that much banging on it is uncommon for most of us, but you can see where it ends up. Let's talk a little bit about arthritis now, because there are a lot of studies out there, and I'm sure you're up to date on all these, but I see chondroitin and other things advertised as a way to prevent it. Is there anything we can do to prevent arthritis from coming on?
Right now, it doesn't seem like there's any medicine or magic drug or pill that we can take. Glucosamine and chondroitin have been around for a long time. I used to recommend it to the patients that would come in and wanted to try something. It's a nutraceutical or a supplement. It wasn't regulated by the FDA. Finally, the government just a couple of years ago did a big study to see, does it really work? Placebos, sugar pills, comparing it to an anti-inflammatory. Right. And in the end, they actually didn't find that it either prevented or really even made much of a difference in terms of pain relief.
Save your money.
It seems that way. Now, the flip side is they didn't see any harmful side effects, and some people take it and they swear it does help. And so therefore, there's not really a harm in taking it. It's not expensive. It doesn't hurt anything.
Sure.
And in veterinary medicine, we've actually seen that vets give it to some animals and they seem to get better. So maybe there's something subtle about it that we don't understand. But, I tell patients, if you want to try it, give it 6 weeks. If it doesn't work, go ahead and stop. Okay.
I see these advertisements sometimes in the magazines for a 30-year knee replacement. If that's the case, a 30-year-old who blows out the knee could have a long one. Is that effective? Does that really work?
That's a great question, and I'm afraid that people are misreading that advertisement and thinking that they should come in sooner and have their knee replacement done sooner. In that advertisement, that company makes a good product and they're trying to promote it, as they should, but what they're saying is in a laboratory for 30 years, which is 30 million steps, the average person actually walks 1 million steps a year.
Right.
The plastic doesn't wear out. That means the metal and plastic can rub together 30 million times and not wear out, but in reality, in a person, there's a lot more that goes into how long a knee replacement is going to last. So there's no guarantee that comes with that brand or any brand of replacement.
Methodist Physicians, if you're looking for more information on maybe some less invasive surgery from Dr. Jana and his associates. Thanks for stopping by. Appreciate it.
Thanks again, Jim.
All right, Rusty's.